Hi there, I'm Annie from MumLife Australia and you're listening to the MumLife Australia podcast where we combine evidence-based information with practical tips to empower, inspire and support mums. In today's episode, we're talking all about children's dental health. Now, when our children are babies, we spend a lot of time as parents talking about teething, but once those teeth emerge, we spend much less time talking about taking care of those teeth. Of course, when it comes to things like regular brushing and keeping children away from juice and soft drink, most of us are across it. But there's a lot of information out there about caring for children's teeth that's either misinformed or completely contradictory. And this episode of the podcast is all about uncovering that information. I learnt so much during my discussion with today's expert guest, and I can guarantee you will too. Our expert guest is Dr Gamer Verdian. Dr Verdian is the principal dentist at Sydney's Dental Lounge. He's also a father of 3 young children, and he really does understand the challenges of raising a family. His advice is backed by science, but balanced with reality. We talk specifically about the recommended age for a child's first dental visit, tips for choosing the correct children's toothpaste, the importance of fluoride, the factors that influence tooth decay in children, the influence of baby teeth on the future of long-term dental health. Plus, Dr Verdian shares his 3 tips for ensuring the health of your children's teeth and gums. Welcome to the MumLife Australia podcast, Dr Verdian. It's a pleasure to have you.
Thanks, Annie.
I'm really excited to have you on the podcast today, Dr Verdian, because in the last year or so, there's been a lot of talk in the media about the growing number of young children with tooth decay, cavities and rotting teeth. One of the headlines I read recently in The Age, which is a Melbourne-based paper, was that kids as young as 18 months needing rotten teeth pulled because of tooth decay. 18 months, that's just crazy. Now, as a mum, when I read that, my first instinct is to pretty much panic. So what I'm really excited about today is picking your brains and setting the record straight on all things children and dental health. But before we launch into that, could you please tell our listeners a little bit more about yourself, your family, and what it is that you do?
I'm Gamer Verdian. I'm part of Dental Lounge, which is a general dentistry practice in Sydney CBD. We are quite a family-orientated practice, and we see kids from all ages, from 1 to 70. On a personal note, I have 3 very small children. I've got a 3-year-old, an 18-month-old, and a 3-month-old. So the dental aspect in terms of looking after kids is important to me on a personal and professional front.
Wow, so that's 3 kids. They must all have brilliant teeth.
You'd think that. My 3-year-old is really good. She listens to us, but my 18-month-old, as soon as he sees a toothbrush, he runs. So we have to run after him. It's quite a bit of an ordeal, and he doesn't recognise my dental qualifications. My wife's actually a dentist as well, and he doesn't have a bar of either of those sort of university degrees.
Wow, that sounds like a bit of a nightmare as a family coming from a dental background. So you said you see children as young as 1. So is 1 the age you would generally recommend for parents to start bringing their kids in to see a dentist?
Our actual recommendation is about the 3 to 4 year mark. The reason we ask mums to bring their kids in, we can actually start developing a rapport with them, where we're, just counting teeth and having a good time, making balloons, putting nice tasting fluoride on their teeth. So we just build wonderful experiences from an early age. So the 3 to 4 year mark is where they build those experiences and look forward to coming to see us. And then after 2 or 3 visits is where we start doing a little bit of cleaning, getting a bit more hands-on. They've just had such a good time that, whatever we do doesn't seem to matter to them. Sometimes we see 1-year-olds and it's more to reassure parents as to what's going on with their kids' teeth, whether, they notice a spot or 2 on a 1-year-old's teeth or a 2-year-old's, that they just want some reassurance that everything's okay. And we're more than happy to do that. But as a general rule, we recommend the 3 to 4 year mark as to be the starting point for regular checkups.
Right, so 3 to 4 for regular checkups, but if you have anything in particular that concerns you about your child's teeth, bring them in earlier.
Absolutely.
So at age 3, which is when you would generally recommend for kids to start coming in, is that the age you would expect them to also start using toothpaste, or should they be using toothpaste at a younger age?
I would recommend using the children's toothpaste from as soon as you start seeing teeth. So just doing a really gentle clean with a bit of baby toothpaste, which has a very, very low fluoride content. That would be the ideal age to start doing a little bit of cleaning and just getting them used to having a toothbrush and having just a touch of toothpaste on there.
I think for a lot of parents, just choosing a toothpaste can be overwhelming. There's such a massive choice now for parents. If you go into a supermarket or chemist, there's the children's version of the standard adult range, but there's now also a wide range of natural, organic, sugar-free toothpastes. And then there's the low fluoride versus fluoride-free options. So just picking a toothpaste for a child can be quite a task. What advice have you got for parents about choosing the right toothpaste? So what is it that we should be looking for?
Sure thing. So the ADA, the Australian Dental Association, did a quite a nice research article recently on toothpaste and what the best ones to go for. And as a general rule, I would say stick with the major companies. You know, the Colgate, the Oral-B's, they do a lot of research into their toothpaste in terms of fluoride content and efficacy. And I would stick with one of those labels. And a lot of the natural and organic ones we see go for the no fluoride option or aim to try and provide an organic content to it, which there's just not enough research behind it to say that it's going to work. And having a really low fluoride toothpaste from one of the reputable brands will, tick all the boxes, scientifically speaking.
Okay, it's so interesting you say that because I have my daughter on one of those organic natural toothpastes, and I have to be honest, the reason why I chose that was because she's only 2 and I was concerned about the fact that she wouldn't know how to spit out the toothpaste at that age, so I wanted something that I thought would be okay for her to ingest. And we've been doing toothpaste now for about 6 months, and even now she still wants to suck the toothpaste off that toothbrush rather than use it to actually clean her teeth. So it's really interesting that you say that. And actually, before we began this discussion, I checked the packaging of her toothpaste, and you're right, the toothpaste actually says that there's no fluoride in it. So what does the fluoride in other brands of toothpaste actually do?
About 100 years ago, pre-fluoridation, there was rampant dental decay throughout all of our communities. The government looked into fluoride as a form of treatment to reduce the incidence of dental decay in the population. They found it has a huge effect. So during development of teeth and once the teeth have developed in terms of maintenance, fluoride has quite a few good effects. One is the antibacterial effect, which it stops bacteria from developing, and 2, it promotes stronger enamel. So our teeth are more resistant to bacteria getting through and doing all the damage they do. In recent times, there is a bit of an anti-fluoridation movement. Generally speaking, there's a ton of science behind pro-fluoridation that just proves dental decay happens much less and dental complications happen much less in kids that have had some fluoride during development and get fluoride daily during their oral hygiene habits.
So the major brands, they're the ones that generally tend to have that right combination of fluoride. What do you do then if you have a child like mine who would rather eat the toothpaste than use it to brush their teeth? Is that a problem for them to be ingesting the fluoride?
No. As long as you're using the children's toothpaste or the baby sort of toothpaste, the fluoride content is really quite low. And they account for kids ingesting the fluoride. There's naturally, it's hard to tell, a 1-year-old or an 18-month-old don't eat that toothpaste because it has a pretty decent taste to it. And it's accounted for, all the research shows that there's no serious effects because of that.
At what age would we then be switching over from a children's toothpaste to an adult's toothpaste?
I would start looking at switching to an adult toothpaste, in the teenage years.
That's actually quite a long time. So the message here is that baby and children's toothpaste is safe, obviously in moderation, and to just be careful to keep children away from all adult-style toothpaste until they're well and truly in their teens. So what I'd love to jump into right now is this issue of the rising number of children who are experiencing tooth decay and rotting teeth. When we read these stories, usually the main culprit is the high sugar diets. So children who've been having lollies and chocolate and juice. Now, correct me if I'm wrong, but there's pretty clear evidence that high sugar diets are bad news when it comes to children's teeth. Is that pretty much clear?
That's right. The other fact that I'd like to mention is also having highly refined carbohydrate that have a high glycemic index. Things like crackers and rice cakes and that sort of thing that sometimes we think is better for our kids is actually almost just as detrimental. Some of the rice cakes and crackers, they have the glycemic index very similar to sugar. So we actually really recommend not having them and being weary of them just as much as you would be a sugary drink.
Really? One of the things I do with my daughter when she's asking me for a biscuit or a chocolate, I try and distract her by offering usually a cracker. Never would I have imagined that giving her a cracker would be just as bad as giving her a biscuit. They're not ideal, but I would never have considered them to be just as bad. So it's actually the high glycemic index that we need to be worried about.
That's right. In terms of being decay causing, yes.
What I'll do is I'll actually include a list of foods that have a high glycemic index on the show notes. So for any of our listeners that are interested, they can look into that further. The other issue that I feel like there isn't enough consistent information about is this thing about children who are having what they refer to as excessive nighttime breastfeeding and children who are exposed to bottles after the age of 1. So in my experience, I remember when I took my eldest daughter to the maternal health nurse at 1, I was asked whether she was still drinking milk from a bottle or whether I was breastfeeding her overnight. And then I remember being told that basically we had to stop or else she'd be at risk of developing tooth decay. Now, if you go online, there are so many people who refute these claims and argue that there is actually no evidence to this. So what's your take on this as a dentist? Is there any evidence that actually shows the effects of breastfeeding or bottle feeding on tooth decay?
Yeah. So this all ties into one sort of common phenomenon, which is basically dental decay comes from a few factors. One is severity of the foods that are ingested. So that we've talked about the sugariness or the glycemic index. Then the second factor is the volume of how much is being ingested, which can affect decay. And the third is frequency. So if you're having sugary foods and, like bottle feeding is one of them, and it's happening at a high volume over a longer period of time, it's probably one of the worst things you could do for your kid. Right, so what you want to do is try and limit the duration of exposure and the frequency of exposure to anything sort of sugary. So, and even breastfeeding, you don't want to be breastfeeding for hours and hours on end because, again, that ties into that concept of severity, frequency, and volume. We've seen kids in our practice who are having sort of juice or something in their cots over an entire night. That sort of level of exposure over such a long period, it has really, really detrimental effects. Bacteria are just like us, they need food to survive and thrive. So if you give them enough sort of sugary stuff over a long period of time, they can really thrive on that, and they do it at our teeth's expense. So
it's a combination of severity, frequency, and volume.
Absolutely. Now, we don't want to dissuade breastfeeding because it's such a wonderful thing, right? We're talking about really taking it into the higher percentages of excess, where if you're breastfeeding for really, really long periods of time, that can be detrimental.
Right. So generally speaking, this is not going to be a problem for most people.
Absolutely not. That's right. So breastfeeding in general works great. We have no... we don't see any issues with it. It's just on the extreme level where it happens over a long, long period of time, and it's used not for nutrition but more for sort of a nurturing over a really long period of time. The main thing when children are bottle fed and that bottle's with the child for extended periods of time, it again ties into the severity, frequency, and volume.
So it's not just as clear-cut as saying that when a child turns 1, they should no longer be taking a bottle or a breast because that will lead to decay or cavities. It's more about looking at that combination of factors being the severity, frequency, and volume that you talk about.
Absolutely. My kids are all breastfed and bottle fed. The last thing I want to do is dissuade anyone from doing that.
You know what I think happens is that parents, in particular mums, they come back from that 1-year visit with the nurse and it's panic stations because the nurse said that your child is now 1, so they must stop bottle feeding or breastfeeding at night immediately. So we have to switch to a sippy cup or we have to wean off that nighttime feeding. And the biggest problem is that in most cases, there's no explanation or evidence given as to why this is the case. And you've just made a really good point there, because you've shown that it's not black and white and that there are actually 3 factors involved, therefore a spectrum of risk that needs to be taken into account. So my next question then is that at 2 or 3 or even 4, these teeth that we're talking about, they're presumably still baby teeth. And of course, we don't want our children in pain, but standing back, I wonder, how important is the health of our children's baby teeth? Because ultimately, they're going to fall out anyway. So does the health of their baby teeth have any impact on the health of the adult teeth that are going to come out afterwards?
Yes. So the short answer is yes. And I agree that saving baby teeth isn't sort of the end of the world scenario that sometimes is made out to be, but we do want to look after them as well as possible. And there's a few reasons for that. One is sometimes we see these baby teeth getting horribly infected. If they get horribly infected, that can affect development of the adult teeth very detrimentally, and that's obviously something you want to try and avoid. 2 is baby teeth are designed to be in the mouth for a certain period of time, and they do that for a few reasons. One is they maintain the space in the jaw for the permanent teeth to come out, and they also allow the development of the child's bite. So if you lose a tooth prematurely, we really do miss out on those 2 factors where the space is maintained for the adult teeth and the child's bite isn't developed the way it should be. In terms of the way we look at it as dentists is, for those reasons, we do find it quite imperative to maintain the children's dentition for as long as they're supposed to be there. Now, naturally, if a child is about to lose a tooth within 3 to 6 months, we don't worry about it too much if there's a bit of decay and it's not bothering them at all. But in terms of sort of a long-term strategy to give them the best chance at having a great adult dentition, there are a lot of concerns for us as dentists.
That's really interesting. That's a lot more complex than just saying, oh, well, they're baby teeth, they're going to fall out anyway, so don't worry about them. It really does show that what happens in the younger years does have an impact on the long-term health of our children's teeth, and it obviously highlights how important this discussion that we've been having has. So, Dr. Verdian, you have been an incredible wealth of knowledge, and I'd love to finish off this chat by giving you an opportunity to share some information with our listeners, because you, as a parent of 3 yourself, you clearly understand what it's like not to have access to the right information. So I'd love for you to take this opportunity today to share 3 things with our listeners that you'd love for mums to know about when it comes to their children's teeth.
Sure. So I'll answer this basically as a parent to 3 kids and my own experiences with that. And I've got a lot of nieces and nephews, and as a dentist as well. So I guess the number one thing would be to build good oral hygiene habits from the start. So the way I do it and the way I think works well is if you spend a decent amount of time each day with your child, and I completely get how difficult that can be, by showing them how to brush, then letting them watch you brush, and letting them watch themselves brush their teeth in the mirror so that they can mimic what they see in you doing. It's sort of like a little event that you do with your child and in front of a mirror. Essentially, the 3 of you build the oral hygiene habits from the start. Right? Because I see this with my kids. When they're at a certain age, they just love to copy me. And if you can build good hygiene habits from an early age, we see that as a cornerstone for the rest of their lives. So kids that have been taught to brush well and have regular dental visits, they take that into their adulthood. And don't need to be told, and they've got wonderful teeth for a long time. The kids that do not have that base end up, having dental problems, and they're not liking their dentist because they haven't had that point at the start. That's probably my second point, which is make sure they come in early, the kids come in early, and they build a good relationship with their dentist so that they enjoy coming. It's one of my favourite things to hear from a parent was that they use the dental visit as a bribe for their children to behave during the week because they just love coming to see us so much. So 2 is having that sort of a relationship right from the start. just builds good feelings, good emotions, and then builds good habits that carry on for the rest of their lives. And probably the 3rd thing is trying not to put too much pressure on yourself as a parent because it's hard. especially if you have multiple children, it's hard to try and coordinate all this and not to feel too guilty about it.
I think you've made a lot of mums at home feel a lot better, saying that as a family of two parents as dentists, you still have to chase your children around the house because they don't want to brush their teeth. So that makes us all feel a little bit better at home.
It is a daily saga. It was for my eldest child, and now it is for my 18-month-old. We're literally running around the house trying to get him to brush his teeth. But, we try and make it fun, and it's a process. If you have good blocks, eventually it'll fall into place.
I think you shared a really good tip there about encouraging them to see themselves when they're brushing their teeth, because children are usually pretty low to the bathroom sink, so they can't actually see the mirror without assistance. So that might actually be quite effective for some parents. So actually get your children into a position so they can see themselves in the mirror as they're brushing. I've really enjoyed having this discussion with you, Dr. Verdian. There's so much we need to be aware of as mums, and you're right that we do tend to put a lot of pressure on ourselves. But the most important thing, and I think you touched on this earlier, is that we need to have access to the right information, and we need to make those choices for ourselves and for our families. I am so grateful you've invested the time into chatting with me and sharing your knowledge with our listeners. Could you just tell us, to finish off, where mums can find you and your clinic?
Sure thing. I appreciate it, Annie. I'm right in the thick of it, all your listeners. I'm happy to help. Name of our practice is Dental Lounge. We're on the Sydney CBD. We're on Macquarie Street. Probably the easiest way to find us is to go to dentallounge.com.au. We're a general dental practice. We look after everyone, and we're happy to help.
Fantastic. Thank you very much, Dr. Verdian. We're going to include the resources to all of the information we've spoken about on the show notes on the website, and we'll also include a link to the Dental Lounge for anyone who's looking for some more information. Thank you again, Dr. Verdian. I really appreciate your time. Thank you for tuning into this episode of the MumLife Australia podcast. You can find details of all the resources mentioned by Dr. Verdian in today's podcast on the show notes at www.mumlifeaustralia.com. And don't forget to join the MumLife Australia community on Facebook. That's where you can have your parenting questions answered by our tribe of experts and our podcast guests.